Hello everyone, I Dr. Shamsher Singh welcome you all to my YouTube channel Pharma Learning. So today I am going to discuss with you about next GPAT question series that hope will be very useful for you all for your GPAT exam. So in this series we have added some tricks as well as some questions. Along with that I will discuss some basic concepts about pharmacology. So the first trick in this series is that how you can remember short acting benzodiazepines. So remember autumn. So A indicate alprazolam, T indicate triazolam, indicate oxazepam, and M indicate midazolam. So you know that these benzodiazepines they act on the GABA receptors. And the second question here can be in the GPAT that where the benzodiazepine target in your body. So they target basically on GABA A and on B also, but major site is GABA A, where they are responsible for the opening of chloride channel and reduce the neuronal conduction velocity and reduce the nerve transmissions. So that means these benzodiazepines they are useful as a sedative, hypnotic, as a you can say muscle relaxant, antidepressant, antipsychotics. So this is the trick that you can remember to learn how the benzodiazepine you can remember which are acting shortly. The next question is which of the following is a true about iron therapy? The options are hemoglobin response to intramuscular iron is faster than with oral iron therapy. Iron must be given orally except pernicious anemia. Prophylactic iron therapy must be given during pregnancy. Infants on breastfeeding do not require medicinal iron. So you will choose the true option from this. You can choose very fast. The right answer for this question is prophylactic iron therapy is must during pregnancy. So I will discuss with you that there are few things that prophylactic. So that means prophylactic are the substance which are required for the normal maintenance of your health. They can be vitamins, they can be some iron like substance or some other you can say the things which are essential for your body. So prophylactic therapy is required during pregnancy. You know that during pregnancy there is a increased function of bone marrow and increased production of RBCs. So that's why iron is must at that time as a prophylactic. The next question in the GPAT series in the Pharma Learning channel is the drug used for controlling tetany is intravenous diazepam, intramuscular vitamin D, intravenous calcium gluconate, and intravenous calcitonin. Very fast you can choose which one will be the right option for this question. That whenever a person suffer from a tetany, then which you can give the right answer is intravenous calcium gluconate. The reason behind is we give a calcium gluconate to relax the muscle because during the hypokalemia, so other option can be in the GPAT that what happen in the tetany. In the tetany, there is a patient who suffer from the hypocalcemia, low level of calcium. So low level of calcium can be harmful for your cardiac functions and some other functions in the body. So to maintain that functions, we give intravenous calcium gluconate. The next question is folinic acid is principally used. The options are in pernicious anemia, megablastic anemia secondary to vitamin B12, along with methotrexate therapy, and in the treatment of folic acid deficiency. So very fast you can comment the right answer for this. So what will be the right answer? The right answer is folinic acid is used along with methotrexate therapy because this methotrexate cause liver damage. So, to prevent the liver damage by the methotrexate and organ associated toxicity, we use folinic acid in combination with the methotrexate. So, this is the right answer for this option. So, the next question is which of the following is reversible inhibitor of platelet cyclooxygenase? Because you know that there are two type of COX, that is COX-1 and COX-2. COX-1, you can say this is harmful, COX-2 is beneficial. This is inducible, this is housekeeping. So, ibuprofen, the option you can select, that what are the option? Alprostadil, aspirin, ibuprofen, CLT4, leukotriene C4. So you choose the right answer. The right answer for this is ibuprofen, and this ibuprofen is a reversible inhibitor of this COX. Even aspirin is a irreversible inhibitor. So you can remember this thing. The right option, this is ibuprofen because this is not a aspirin, which is an irreversible inhibitor of cyclooxygenase, and both they are used as anti-inflammatory. Even this is a preferable drug for arthritis and pain associated to the joints, and aspirin is also preferable as an antiplatelet drug. So this is the right option, ibuprofen. The next question is demiprit is a agonist of dash receptor H1, H2, H3, all of the above. You choose the right answer for this question. The right answer is H1 receptor. So basically this drug which is used on a H1 receptor, it is having a anti-inflammatory actions also and anti-allergic in rhinitis. So this agonist H1 receptor, it is useful in case of these conditions where there is a inflammation of bronchial tract or some other part of the body or allergic reactions which are associated. So the next question is a trick type of question. Busulfan, remember A, B, C, D, E, F, is a alkylating agent. Yes, it is a under the category of alkylating agent. Bone marrow, that it affect to the bone marrow functions. Chronic myeloid leukemia, yes, it is used for the blood cell cancers. Dark skin, because you know that whenever you use busulfan for a long time, it start to accumulate in the dermal layer of the body. That's why it causes darkening, hyperpigmentation. This is caused by busulfan. Emesis and fibrosis, these are the side effect of this busulfan. It produce diarrhea, emesis, like you can say side effects. So this is the trick which you can remember. Next question is earliest sign of aspirin toxicity is tinnitus, metabolic acidosis, Ray syndrome, and respiratory depression. Very fast you can comment in the box or right answer you can choose. The right answer is tinnitus. So this is a ringing type of sound which is produced in the ear, and basically it is due to the long term use of aspirin or the use of aspirin at a higher dose, more than 1 gram. So this is due to interference of aspirin with the calcium which is present in the perilymph fluid of the internal air. So that's why this is the ringing type of sound. Long term use of aspirin is the side effect. So the next question is, the term eicosanoid refer to which of the following compound? The options are prostaglandin, leukotrienes, interleukins, and D is A plus B. So you choose the right answer for this. The right answer is A and B. Prostaglandin and leukotrienes are eicosanoids. So you know that eicosa indicate 20 carbon atoms. So the compound which are synthesized from these are prostaglandin, PG, and leukotrienes. So these prostaglandin and leukotrienes, they act as inflammatory agents, and some of the prostaglandin act as a anti-inflammatory also. So they are related to the inflammation basically. The next question is, activation of endothelin receptor ETA leads to vasoconstriction, bronchoconstriction, aldosterone release, all of the above. So very fast, what will be the right answer option for this question? The right option is all of the above. So basically you know that endothelin endothelin means the substance which are released from the endothelium of the blood vessels. So this is endothelium tissue layer. From that there is a release of endothelin which is of two type, ET1 and ET2 receptor. Basically ET1 receptor cause calcium dependent constriction, ET2 cause vasodilation related to nitric oxide. So you remember always that endothelin 1 act on ETA, either ET1 or ETA or ETB you can say. They are responsible for the vasoconstriction, bronchoconstriction, aldosterone release, all of the above. So this is the right answer for this. The next question is, vasoconstriction is produced by following agents. The options are sympathetic amines, eicosanoids, endothelin, all of the above. So you choose the right answer for this question. The right answer is all of the above. So you know that vasoconstriction means blood vessel constriction. So these are your blood vessel. Sympathetic amine, adrenaline, cause blood vessel constriction by alpha 1 receptor, that is calcium dependent mechanism. The first answer is right. The second answer is eicosanoid. I have discussed now eicosanoid through ETA. Eicosanoid, they are responsible for the vasoconstriction depending upon the release of prostaglandins. So like PGI2, so TGF. Now the third is endothelin. Endothelin by endothelin A receptor or a one type of receptor depending upon the calcium release cause vasoconstriction. So these all are the right answer for this question. The next question is monoamine oxidase inhibitor. Options are do not cause postural hypotension, are known to reduce blood pressure by depleting catecholamines, have a prompt hypotensive action, generally do not cause tachycardia. So you choose the right answer for this. The right answer is generally do not cause tachycardia. So basically you know that monoamine oxidase, that is they are the enzyme which cause oxidation of catecholamines in the body. So monoamine oxidase enzyme are of two type, A and B. So MAO inhibitors they are preferably used as a, you can say, in case of Parkinson disease, where you know that MAO cause degradation of dopamine, and dopamine is degraded into HVA, homovanillic acid, and DOPAC, dihydroxyphenyl acetic acid. So this is the metabolite of the dopamine. That's why the first time whenever there was a discovery of dopamine, HVA, homovanillic acid, was checked or found in the urine of some of the species. So from that discovery, there was a known that dopamine play major role in Parkinson, and it is metabolized in the body. So this is the right answer. Next trick is how to remember third generation cephalosporin. So basically they are enzyme, cephaldoxime, cefixime, cephaloxime, and ceftazidime. So this cephaldoxime, ceftazidime. So these are the drugs, enzyme containing drug. They are the called as third generation cephalosporin, which were discovered around in 1980 to 1990. So they are very useful drugs, both active orally as well as by intravenous route. So these are the useful drugs. So next question is, a drug administered by inhalation of powder as a prophylactic for asthma is? Options are ephedrine, disodium cromolyn, isoproterenol, and oxytryptyline. You can choose the right option for this question. The right option is disodium cromolyn. So this disodium cromolyn, which is used for the asthma in the powder form in the acute type of asthma. So in the acute type of asthma, this is a useful drug which can be act by mechanism that is mast cell stabilizer. So another question which they can ask in the GPAT is, what is the mechanism of disodium cromolyn? Disodium cromolyn is a mast cell stabilizer. So this is the right answer for this question. The next question is, which of the following expectorant act both directly on the airway mucosa as well as they act as a reflexly, mean reflux? The options are potassium iodide, guaifenesin, terphenhydrate, and bromohexane. You choose the right option: potassium iodide, guaifenesin, terphenhydrate, and bromohexane. So the right option is potassium iodide. So basically you know that this potassium iodide only help to increase the mucus movement. So then that means the iodine or the potassium iodide, they having additional property that they reduce the viscosity of the mucus and increase the movement of the mucus, so that the reflux can be happen. So that's why potassium iodide is the right answer for this question. Next question is, intranasal spray of budesonide is indicated in common cold, acute vasomotor rhinitis, perennial vasomotor rhinitis, and epistaxis. So you choose the right answer. Budesonide is used for perennial vasomotor rhinitis. So this is the problem where the budesonide, which is a steroid, which is under the category of steroid, cannot be used for a more than 4 days or not more than 7 days. Basically in case of the person who suffer from this rhinitis or some, you can say, asthma like allergies. So this is the right answer for this question. The next question is, methylxanthine exert following actions at cellular and molecular level. The options are intracellular release of calcium, antagonism of adenosine, inhibition of phosphodiesterase, all of above. You choose the right answer for this question, methylxanthine. The right answer is all of the above. So that means I will discuss that these methylxanthine, they are the xanthine derivative preferable for at the cellular molecular level. They inhibit the calcium that can be by IP3 DAG pathway. They antagonize adenosine release and inhibit phosphodiesterase and increase the level of CAMP and increase the smooth muscle relaxation by dephosphorylating myosin light chain kinase. So basically these xanthine derivative, they are very useful as a smooth muscle relaxant. How they act as a smooth muscle relaxant at cellular level? They inhibit IP3 DAG pathway dependent calcium. They inhibit adenosine, cause antagonism on the adenosine receptor, and they inhibit phosphodiesterase. So these all are the right answer. The next is chloramphenicol is particularly effective in diphtheria, tuberculosis, emphysema, and rickettsia. You choose the right answer. So it is used in rickettsia, which is a bacterial infection and commonly happen in the small children's, that can be from animals, ticks or some other things. So this is the right answer. Chloramphenicol is useful for this disease. The next is a trick for aminoglycoside. Remember, amino against aerobic bacteria, mainly bactericidal, inhibit protein synthesis, nephrotoxic, autotoxic. So this is a short form where you can remember 5 property of these particular aminoglycoside. They are more effective against gram positive bacteria. They are for aerobic bacteria. They are bactericidal because they inhibit the protein synthesis of the bacteria, and they are nephrotoxic because they are having a wide volume of distribution in the blood. So volume of distribution for the aminoglycoside is more, that is less than chloroquine, but it is more than many drugs. That's why they are nephrotoxic. Similarly, they are autotoxic. So in case of autotoxicity, they can cause deafness. So this is the trick you can remember. An advantage of beta-methasone acetate over beta-methasone sodium phosphate is fewer allergic reactions, prompt actions, more sustained actions, greater solubility. You choose the right answer. The right answer is more sustained actions. So the beta-methasone acetate can act in the body for 2 weeks, nearly 2 to 2.5 weeks. It can produce action in the body, but instead of beta-methasone sodium, which is readily hydrolyzed into ionic form and show a less time, that is a short time action in the body. So that's why beta-methasone acetate produces sustained action at least for 7 to 14 days. The next question is, superinfections are more common. Options are with the use of narrow therapeutic antibiotics, narrow spectrum antibiotic, short course antibiotic, use of antibiotic that are completely absorbed from intestine, and use of antibiotic in combination with covering both gram positive and negative bacteria. You choose the right answer. The right answer is use of antibiotic combination covering both gram positive and negative bacteria. So basically, what are super infection? These are the infection which can very fastly be transferred or can be happen at any area where there is a previously infective organisms are present. So Sometimes these super infections they affect to those people who are weak immunologically, their immune system is weak, so that's why this is the problem. So the next question is, all of the following statement about stool softener are true except there is a minimal systemic absorption, onset of action is usually 1 to 2 days, they are useful in patients with constipation who have experienced acute myocardial infarction, they can be taken with little or no water. You choose the right answer. That means true statement accept. They can be taken with little or no water. So basically, you know that stool softener like ispagol seed or some other substance, they basically we dip in water and we use always with a maximum, you can say sufficient amount of water, so that they can act as a stool softener and they are useful for the patient with constipations. The next question, select the drug which can improve urinary flow rate in benign prostate hypertrophy without affecting prostate size. Options are prazosin, finasteride, amphetamine, gosirelin. You choose the right answer. The right answer is amphetamine. So basically you know that this is a controversial statement. Amphetamine basically produce also sometime a urinary retention, but this amphetamine is act as a stimulant and increase the activation of porine channel in the urinary tract and known to improve urinary flow, as they are this amphetamine never affect the benign prostate hypertrophy, but amphetamine is never used in case of patient who are, you can say, suffering from sleep apnea or some other sleep associated disorders. So amphetamine is not preferable in that type of the patients. So the last question for this part is, which one of the following agent act at a step of antigen recognition? Options are cyclophosphamide, cyclosporine, methotrexate, and raw immune globulin. You choose the right answer very fast. The right answer is RHO immune globulin act at a step of antigen recognition, because this RHO immune globulin is an antibody and this antibody provide a site which recognize the antigen in our body. So that's why this is helpful to you can say identify a specific type of antigen in our body, and this is a very useful in case of ELISA also, globulin immunoglobulin, as antigen antibody reactions to proceed. So the last trick is P4 cytochrome P450 inhibitors. Remember SIC, sulfonylurea, indinavir, chloramphenicol, ketoconazole. So basically you know that these inhibitors which inhibit the enzyme cytochrome P450 in the mitochondria, they interfere with the metabolism of many other drugs. So that's why some of the drugs, that antidepressant, antipsychotic, or anti-epileptic, anti-TB drugs, they never be administered along with these drugs, because these drugs promote the toxicity of antidepressant, antipsychotic, anti-epileptic drugs, because they are enzyme inhibitors. So hope this series was very useful for you all and you get a lot of options to remember some of the tricks which will be useful to appear in GPAT exam, and in the coming videos I will share more videos from the related subjects, and you are welcome to Pharma Learning channel. You watch, like and subscribe the channel. Thank you very much.